Imagine an older Mexic walking into a busy clinic here in Malaysia. She looks, completely distressed and announces that she has pain absolutely everywhere.
Right, literally everywhere.
Yeah, so she pokes her forehead and groans that it hurts. She pokes her chest, says it hurts, pokes her knee, still hurts.
It sounds like a total systemic failure. Well, until the young doctor realizes the twist. I mean, her body isn't broken everywhere.
Yeah.
She is actually poking herself with a fractured finger.
Exactly. Everywhere she touches hurts because, well, the tool she's using to assess the pain is the actual source of the problem.
It's such a brilliant story.
It really is.
Uh,
And that comes from psychiatrist Dr. Pun Cheng Carr's book on practical mindfulness, which is written specifically for dedicated healthcare professionals like you. So, welcome to today's deep dive.
Thank you. We are looking at what Dr. Pung calls Semua Sakit Syndrome, or all-over pain.
Right. And we're decoding what your body is actually trying to tell you during those exhausting hospital shifts.
Ah.
Because, it is a lot like driving a car with a flashing check engine light.
Oh, absolutely.
But instead of actually checking the engine, you just put a piece of tape over the dashboard light and keep driving.
That is a perfect analogy.
Yeah.
And that fractured finger, or the taped-over light, that represents unmanaged stress.
Right.
For a busy nurse or doctor, stress rarely starts as like a clearly articulated anxious thought.
Your mind is far too busy charting and rushing between wards for that.
Exactly. So because you aren't processing the emotional strain mentally, your nervous system steps in. It stays in overdrive.
Pumping out stress hormones.
Yeah, which triggers widespread inflammation, muscle tension, or gastric distress. I mean, your body knows it is overwhelmed long before your conscious mind even registers the emotional burden.
But wait, hold on. As medical professionals, we are literally trained to neutralize the physical symptom, right?
Sure, yeah.
So if a junior doctor gets a tension headache mid-shift, or a nurse has severe gastric pain, why shouldn't they just, pop a painkiller and keep moving?
Right?
I mean, why turn a simple stomach ache into this deep emotional burden?
Well, it's a very fair point. And treating the immediate physical discomfort is completely necessary. I mean, you have to function.
Right. You can't just stop working on a busy ward.
Exactly. But ignoring the root cause means the pain will just keep returning. Those physical complaints are frequently disguised emotional burdens.
So the physical manifestation is a warning.
Yes, and masking it is dangerous. Think about it this way. Ignoring the root stress to just pop an antacid is exactly like silencing a patient's telemetry alarm instead of actually checking their vitals.
Oh, wow. You just mute the beep and walk away, pretending the monitor was the only problem.
Right, which guarantees a rapid response code later on. When you look at the reality of healthcare work, you are dealing with constant demands, lack of sleep, emotional trauma.
It's intense.
It is.
Yeah.
Healthcare professionals are brilliant at diagnosing complex illnesses in their patients, but there is this cognitive dissonance where you actively suppress your own physiological alarms.
Often out of a misplaced sense of professional duty.
Exactly. You ignore your own body's early cries for help.
We're trained to be hypervigilant for everyone but ourselves. So if you are listening to this right now before a chaotic shift, what does this mean for you?
Wow.
Because the link between ignored emotional stress and physical Simua Sakit pain is truly causal.
It really is. So if there's anything you take into your next shift, let it be these three main messages. First, remember that unmanaged stress often manifests physically first.
Yeah.
That is the all-over pain.
Right, the check engine light.
Exactly.
Yeah.
Second, unexplained physical complaints are frequently disguised emotional burdens. And finally, listening to your body's early cries for help is essential. Caring for yourself is literally required to properly care for your patients.
So here is a simple call to action for you. The next time you feel an unexplained ache or a tight chest during a crazy shift, don't just blindly push through it.
Don't just silence the alarm.
Exactly. Take a 1-minute mindful pause to check your stress level.
And as you head out there today, I want to leave you with one final thought to ponder. What stress is your body carrying today that your mind hasn't found the words for yet?
Wow. It really is time to look at the finger doing the pointing.
Yeah.
Thank you so much for joining us on this deep dive, and please take care of yourselves out there.